Inspect it. What are we inspecting for?
Expiration date, no holes.
Expiration date, no holes. What else?
It's
All intact,
no witness.
no wetness.
Everything.
Allergies. Okay? So we're gonna wash our hands, we're gonna go to the room, and we're gonna tell our patient, hi, Miss Jones. My name is Miss Fortin, and I'm scheduled to do a catheter on you today. Your bladder's not draining well, so the doctor ordered one for you. So when you come in that day for your competency, you will have a chart on that bedside table. You have to check your order, or at least tell me you're gonna check it. You can't insert a Foley catheter without a physician's order. You'll see in the chart, physician's orders, just flip it up and you're gonna see Foley catheter to gravity drainage, okay? And that's gonna give you your order. You're gonna identify your patient. This is Miss Jones, and date of birth is 1/13/96. He told me all of it. He's just talking to me. He says he has no allergies, okay? So we're gonna let the bed up to the waist, a good working height. I do not know if you're gonna have to do, draping or not with the sheet. In the past few semesters, we have not made students do that because sometimes it's just more risk for messing it up. I'm just gonna be honest with you, okay? Or contaminating easy. So you don't have to use the drape, but I'm gonna show you how to use it, okay? So, if you choose to use it, fine. If you choose not to use it, fine. I'm gonna get with faculty and see what they wanna do. Before you do anything, I would check with my instructor. Because some instructors may want it, some may not. So just check with your instructor to be sure. And they will let you know if they want to use, if you need to use it or not. There's another drape in the inside that I'm gonna tell you the same thing about. Some instructors want you to use it. Some instructors don't make you use it. And we do that because it's not really required in the hospital setting. So most rooms that you use now are semi-private. So the purpose of the drape was kind of to give you some privacy. But if it's a semi-private room, what can you do?
Curtain.
Just pull the curtain. And that still gives that patient all that privacy. Okay? Alrighty. And then once you do it like that, it's almost like making a draw sheet, but you're trying to get to a triangle. I guess you see now why I don't care to use a drape. It's too much to try to make it. Okay. So, you make it like a triangle, and what we're gonna do is wrap it around the leg and things like that, okay? Okay. So we got it made. This patient probably took a little fanning over it. Alrighty then. Did that get us? Yeah. That got us where we need to be. Except, you just kind of form a triangle. And then you're gonna take this with your patient's legs up. And you're gonna drape it over the patient. And you take this portion and throw it back. So in other words, you went through all of that just to drape it back, okay? Now, when I was in nursing school, we had to do all these. But that's not necessarily the case anymore. Like I said, I'm gonna talk with the team and see what they want. You see how that's flapping? That's why I don't really agree with that. But we'll see what the team says, okay? So, we got a good open area to insert the catheter. You see where we're gonna insert it. Not the rectum, not the vagina. That's what we're gonna, that's right. Okay? All right. So, then I'm gonna show you how to do yours too at the end, okay? So, we're gonna get ready to insert this catheter. We've identified our patient, we've washed our hands. What are we gonna check for now? I can't hear you. Allergies, we did that.
So we should do that one, maybe right before you get ready to insert. Just maybe-
What are we looking for? Where are we about to insert something?
Urethra.
So what if the vagina is nasty and it's just nasty there? Urethra is nasty, perineal care. Okay, so we're gonna look, and if they need perineal care, we're gonna clean them up, and then we have to go wash our hands again. Because we don't want to clean them up, put on sterile gloves, and go through with the procedure, okay? So make sure you mention that. You're gonna assess whether or not they need perineal care, and you can do all of that before you drape them or anything, just to know what you have to do. And when you look at your handbook, you're gonna see that some steps you just want to get over with when you first go in there. You don't have to worry about remembering to do those anymore, okay? So that's one thing. We want to make sure that perineal area is clean because we don't want to introduce any more bacteria in there. Any bacteria, actually. Okay? So that area is clean, and we got a good opening. I try to spread the legs further apart because I'm going to move my catheter there. Okay? You'll see where some people will choose to do everything from the bedside table. I don't recommend that. Because when I move from this bedside table, what do? Turn my back to the sterile field, and that's a violation of one of those 7 principles. Okay, so I don't recommend that, but to each his own. You know, whatever you choose to do. If you choose to use another pair of sterile gloves versus the ones in here, that's fine. When you come in, you can just get those gloves. And you can put those on when you get to the place of putting your sterile gloves on. Okay, however you choose to do it. Now, the thing I see students get apprehensive about is they walk in and they can't figure out how to open this thing. And that gives them even more anxiety than they already have. Don't get anxious about it, you guys. You see this little flap at the end? It peels up. And it don't want to let go right now. But it's going to peel up, okay? And then it just comes open. Okay? So, now, I'm going to take it out. Is anything sterile as of yet? No, it's not. So, I'm going to take this and I'm going to sit it to the side. Why am I going to sit this to the side?
So you know what size?
So I know what size, because I got to document what I did at the end and what I inserted in this patient. Okay? So I can document the size, and it'll have on here the size of your balloon as well, but that's also on your catheter, and I'll show you that. Okay? There's another little label in here with where you can sign that you did it and the date of insertion. A catheter usually stays in for 30 days. Sometimes there are situations where patients might be difficult to catheterize or large, and the doctor may give you a longer order. But you need to put that date of insertion on that catheter bag when you're done. Okay? All right. Some people choose to use this plastic to throw away their things. It's completely up to you, or you can use the garbage can. I'm one of those that like using the garbage can because I don't want to risk trying to go over my sterile field. But that's completely up to you. If you choose to use the bag, you can use the bag. Okay? The garbage can. Oh, it's here. So you can make sure your garbage can is there. However you want to do it, that's up to you. Okay? Now, so you see how my sterile field is sitting?
Mm-hmm.
Do I have the right to flip it around?
Yes.
Do I need to flip it around?
Yeah. Yes.
Why?
So you open it away from you?
That's right. That's right. You got that from your lecture. Good job, okay? So, I fixed it the way I want it. Make sure you look at it, you guys. That's like setting yourself up if you don't. Because they're all just about like this. But don't panic if you don't have this little flap sitting here. Because sometimes it's not. It gets tucked away some kind of way in packaging. And it's not. But remember, you can always just pull up. Okay? So if you need to do that, that's okay. Okay? So you're going to pull it away from you first. Okay? Now, you're just going to take the other side. Remember, none of this is sterile at this point. And I can be within my what?
1 inch border.
1 inch border. Okay? And then I'm going to get this side and I'm going to tug at it. Now, are these flaps going to always stay back like I really want them to do?
No.
No, they're not. Okay? And when that happens, I'm going to show you what you can do. Remember, none of this is sterile. So you see how that's trying to flap back on me? And I really don't want it to. So I can grab it at that 1-inch border and pull down. I'm still within that 1-inch border. And you see how it's staying down now? And even over here, I like to do that because I know it's relaxed. Does everybody understand that?
Mm-hmm.
Some people choose to put on their gloves after they do these next two things. That's completely up to you. I like to go on and put my gloves on because then I know everything I'm working with is sterile. It does not matter to me how you do it. You know, some people even choose to put their sterile gloves and fix everything here and then just go from here. I don't like that because there's too much distance between me and my patient. But I can't tell you how to do it. That's completely up to you. You do what makes you feel more comfortable. Okay? All right, so I'm going to pull this over just a little bit because I want some room to put my gloves on. You'll understand what I mean about these little gloves. You see how tiny they are? And me and you're probably not going to be able to wear these gloves. I'm just going to be honest with you because they're so small. Okay? So, here I go again, putting my sterile gloves on. See how that just don't want to go anymore, and I'm not going to fool with it. So I'm going to come over here, and I'm going to pick up my other pair, my other glove. But that one went on pretty good. But if you can see the difference in these gloves, you guys, these are very thin. And these are a little bit, you see how that hole got in there? So you have to be careful with that. Now, do I have on an adequate pair of sterile gloves? No. If I was doing an actual catheter change, I probably would change gloves. Okay? But we ain't got the money to do that around here, so we got to keep going. Okay? So,
What if that happens during your competency while you're doing?
you can let your instructor know.
Okay.
We'll see something like that. Okay? But now you can tell us if you feel like you made an error, but you can't do that the whole competency and think you're going to pass. Okay? Now, so this is a little barrier that goes underneath the patient to protect from moisture hitting the bed. Do you see this shiny side?
Mm-hmm.
That's right. Shiny side down. Okay? Because we want it to collect whatever it can collect. And I'm just going to lay it there. Why? I don't want to take the risk of contamination. Could I move it in the center? I could, because remember now everything's sterile. Okay? Now, some people choose to do these, you guys, before they put their gloves on. Whatever works for you works for me. But I don't want to be fooling with my sterile field when I don't have gloves on. Okay? Because that increases my risk of contamination. Now I can touch it anywhere. Okay? Now this is the other drape I was telling you about. Okay? So I'm just going to bring it over and I'm just going to drop it. Do I have the right to move it? Yes. But can I move it near the vaginal area? No. Okay? Because I don't want to ruin that option of allowing my hands to hit something it shouldn't hit. So I'm going to remove a pack of these. And then everything here is sterile, so I'm just going to take this and move it over. Okay? All right? Now that I have this here, I'm not going to say I may not move this over. Because remember now, everything's sterile. Okay? So I have the option of touching everything. Okay, so I'm going to open these. And this is what I'm going to do. I'm going to come back around and drop. Okay? Remember, I can't go below my waist, so I got to just drop it. Some people choose to use the bag where you have to go around, out, and back around to the bag. That's not my preference. If that's what you want to do, that's what you do. Okay? So then I'm going to put these here because this is what I'm going to use. Now, some students don't feel comfortable doing all of that because this is new. So if you want to leave them in the pack and put the pack upside down, everything is sterile here. Okay? So I'm going to come back around and drop. Okay? So now I'm going to go through the process of opening my lubricant. Remember, when you're inserting something in something, it needs to be lubricated. And I'm going to put that there. Now, you have the option of sending that lubricant, this empty package, over to the side, or you can come around back and drop. Okay? All right. So I got all of that in there, and next I'm going to test my bulb. it's been some confrontation with this, not really confrontation, but discussion with this in the past where we've decided to do it, we've decided not to do it, to inflate the bulb. I'm old fashioned, so I want to see that bulb go up. Because if I get that catheter in and it don't fit or it don't stay, then I got to redo the whole process again. So that didn't do me any good to say I was doing a sterile procedure. Okay, so now I'm going to insert my saline into this balloon. And remember, everything's still sterile. Okay, and I'm going to see that balloon inflate, so I know my balloon is working. Okay, I'm going to leave that in there. Now, I'm going to take this plastic off. Be careful, you guys, when you're dealing with this. That's how we can tell if you practice or not. Because if this thing comes out and it flaps and hits that leg, that's contaminated. Okay? So, you got to be careful with how you take it out. All right. And we're going to sit that right there. Okay? So we can get lubricated. Okay? And we're going to hope that it just stays there. Do sometime it want to flop? Oh, yeah, it does. Okay? And I'm going to come around back and drop. Okay? So, what are we ready to do now? Clean. We've tested our bulb. We've done everything we should have done. What some students choose to do is go on and take this bag out. It does not matter to me, but once I've taken that top off of there and that KY is on it or lubricant, I just try not to fool with it. It's completely up to you. Some students, like when I pulled it back, they go on and take it out the box. Whatever works for you. When you practice, you're gonna know what works for you. That tells us if you practiced or not. Okay? So once I put my dominant hand on that vagina, can I move it again? My non-dominant hand? No. Make sure you put your non-dominant hand there, because if you're right-handed, can you work with your left hand? No. So you probably need to be on the opposite side of the bed. Okay? All right. So I'm going to put my hand here, and I cannot move this hand again. If you move it again, you will fail. I don't care who your instructor is. Okay? Now, so I've put my non-dominant hand there, and I'm going to clean my patient. Okay? I'm going to clean it from farthest away first. Come around back, discard. I'm going to clean the other side. Okay? Down, back, discard. And then I'm going to clean the middle. Okay? Down, back, discard. Now, you may want to get to a point where you may want to do farthest to closest. So if you want to do that far side first, the middle, and that closest side, that's fine. You should still pass your competency. Okay? But do not do closest to you and work farthest away from you. Y'all understand that? Okay. So now she clean. She's squeaky clean, okay? So now we're going to insert this catheter. I'm going to tell her to take a deep breath. And we're going to insert it. Okay, I see urine, so how much further do I insert? 1 to 2 inches. You got to look over your protocols. And then I'm going to hold it there. That means it's in. So now I'm going to inflate my bulb 5 ml like it told me. And guess what? That means I know it's in place. I'm going to try to tug on it. It ain't moving, so that means it's in there. So I'm going to take this, and I'm going to tape it to the leg. And remember I told you somewhere else you can see that, 5 ml. It's right there on the counter, okay? I don't care about that leg because my sterile procedure is over now, thank God. Okay, so don't freak out as a student. I'm going to tape it to that leg. Give me that. The right, yeah. This is a catheter strap. Don't worry about anything like this. If you're doing a catheter, if you're doing your comp, just tell me you're going to tape it to the leg because you won't always have one of these anyway. Okay? We got this all backwards, but we going to make it work, y'all. Just don't leave it on your patient really like this. And then it goes in a little flap. Yeah. That's here. You just put the catheter through that like that. I'm going to show y'all the real way to do that when we get through. This, and you can disconnect your syringe. okay? Because you don't want it to come back out at you like it did at me. So once you get it in there, you disconnect your syringe. Now, so now we know that catheter's in place. We're gonna take our bag and we're gonna hang it on in a movable part of the bed, okay? And we're gonna watch that urine flow down. That's what I meant when I said cloud of urine coming out, okay? So, I see 500 mLs of clear yellow urine draining back, and that's what I want to see, okay? We don't want it to drain back too much, over 1,000 mLs, because that causes different things like neurogenic bladder, things like that. So we need to be careful, okay? And that's basically it. Observe the patient, make sure they tolerated it well, anything like that. So that's basically inserting the catheter, okay? Now, what are we gonna do if okay, we got the catheter in, now you gotta take it out. So what do you think we're gonna do?
You have to deflate the bulb.
Deflate the bulb, that's right. So of course I got everything handy here right now so I can just deflate it. But if you had to do it for a patient and you didn't have it, make sure you have a waterproof moisture pad, okay? Go in and explain everything to your patient that you're gonna do. I'm gonna take your catheter out, we're gonna retrain your bladder, and you may feel a little bit of discomfort, but I'll tell you when, and I just need you to take a deep breath for me, okay? To make sure the patient don't have a lot of urine sitting on their bladder, you can just press here on the symphysis pubis, right here where the pelvic bones connect, and it'll let you know. That patient shouldn't have pain there though. If they have a catheter and it's not leaking, then you know that if they do, that means they're holding on the urine, okay? But we're gonna tell them to take a deep breath. We're going to connect the syringe, and we're gonna aspirate the fluid back, okay? And once I get 5 mLs or I meet resistance, I know I've gotten all the solution out. And then I'm gonna just tell them to take a deep breath and I'm gonna pull it out. Now what do you think this is gonna look like? Yucky. Because it's been in for a few days, sometimes all 30 days, and you're just replacing it, okay? So always make sure, that's why you want that moisture-proof pad there, okay? And you just lay it on there, and you can bottle it all up in that pad and put it in a red bag, a red biohazard bag, and discard it. Yes, you have to tell how to take it out. You don't have to go through the motions, but you do have to tell them how to take it out. And the main thing you remember is deflate the bulb, okay?
So, you have your sterile gloves on when you're taking it out too?
No, it's not a
So-
sterile procedure to take it out, it's just that I'm doing it at the end of this.
Okay, so you're washing your hands and then you would come back and then take it out?
Yes, once you get a moisture-proof barrier there and you assess, then you take it out.
So when you put the strap around the leg, do you have to have, that's not considered sterile, is it?
What?
When you put
No,
it-
once you get it in, Jordan, and you put that bulb in, you're done. The sterile portion is over. Once you get that catheter in and inflate that bulb, the sterile portion is over.
Okay.
Once you see, you remember how I put it in and I said, okay, I see urine, so I'm gonna insert 1 to 2 more inches, and I did this, your sterile part is over.
Okay.
But if you go flopping around because you're so glad, because you feel like you didn't made any mistakes, and you don't inflate that bulb, guess what? That catheter gonna follow you right back out, and you just defeated your whole purpose.
So in
Okay.
that situation, after the catheter is in,
Mhm.
before you put the thing on the leg,
You don't put the thing on the leg.
Okay.
That's confusing you guys. Just say I'm gonna tape it here to the leg. You just hold it with your hands and put the bag on the bed.
okay.
Don't get focused on that part of it. That's not a part of the procedure.
So would you need to change your gloves though before touching their leg?
No, you don't have to.
Okay.
Mm-mm. Too deep. Too deep. you
Because they
guys.
should be sterile still,
Too deep.
technically.
Okay.
Well, if you touch your vagina.
You're too deep.
Right.
Too deep with that.
Okay.
You can
So
clean a
just
patient
continue-
up once you get done.
Just continue with the same gloves and do everything?
Yes, y'all thinking way too deep with that, okay? Because if I try to go change my gloves before I stabilize this catheter, I got a whole nother problem where I'm finna have to bill an insurance company for another catheter and they not gonna pay for it and my hospital's gonna have to pay for it. So that's too deep of thinking, you guys.
Is there a certain way we gotta clean it up, like all this?
Uh-uh.
Or just
When you
regular?
you just grab it all up and put it in the garbage.
Okay, I do have one question. When
Mhm.
you've got that barrier around the catheter, do you have to rip
Yeah,
it
it's
somehow?
paper.
Okay, so you just rip it
That's
off.
why it's
Okay.
paper.
I was like,
Yeah, that's why it's paper. You know, I hope we can come to an agreement that you don't have to do that for competency, but I don't know.
Okay, question now, what did you put over there on that, in that little pack that came out of that pack? What
It was
it?
just 2 in here.
Okay.
So I just took one out so
Okay.
it wouldn't be in my way. It'll be 2 in your pack. You'll
Okay.
use this same kind when you do your competency with us.
I would use one of those packs.
Mhm.